Welcome, everyone, and thank you for taking time to be with us today to discuss social emotional learning and mental health supports in out-of-school time. I'm Siobhan Braden with the National Center on After-School and Summer Enrichment, or NCASE, and in support of truth and reconciliation, I acknowledge that I am participating from EDC headquarters in current-day Waltham, Mass., which is located on the unceded lands of the Pawtucket and Massachusetts peoples who continue to live and thrive in this area. Many of you are likely familiar with NCASE, but for those that aren't, NCASE is part of a national training and technical assistance system funded by the Administration for Children and Families, Child Care and Development Fund, or CCDF, administered by the Office of Child Care, under the U.S. Department of Health and Human Services. This network of national centers supports states, territories, and tribes in implementing CCDF to provide low-income families who are working or participating in education with help paying for childcare. And our focus is on school-age children ages 5 to 12. My co-facilitators today are Bianca Reed and Kate Hamby-Hopkins. We're pleased to have three panelists joining us today who are going to share examples of their work during the panel discussion. Usman is the Senior Policy Analyst with the Georgia Statewide After-School Network. Randy Neve is the Network Lead with the Wisconsin After-School Network. And Jennifer Smith is Program Coordinator also with the Wisconsin After-School Network. Welcome. Here's our agenda for today. We'll begin with an overview, relevance, and best practice presentation. Then we'll have a panel discussion. And then we'll have an opportunity for participants to engage in discussion using Padlet and the chat. We'll share some resources, and then we'll wrap up. And the content that we'll be sharing today is from a forthcoming toolkit on this topic. And Bianca Reed, my colleague, is the lead author. She'll be sharing that information with you today. Please feel free to put questions in the chat throughout. And now I'm going to pass it along to Bianca.
Wonderful. Thank you so much, Siobhan. And thank you everyone for joining us today. My name is Bianca Reed, and I am the Training and Technical Assistance Associate here with NCASE. So our learning objectives for this session are as follows. Siobhan, can you go to the next slide, please? Fantastic. So essentially, we want folks to be able to distinguish the difference between social emotional learning and mental health support. We also want to make sure that we're classifying the importance of SEL and mental health within OST programming. We'll also make sure to take some time to identify strategies and activities for system leaders and program providers to integrate high quality SEL and mental health support in OST. And lastly, we want to make sure that folks are able to locate applicable materials, evidence-based tools, and resources to incorporate SEL and mental health support in OST programming. So we have a lot to get through today, and I'm very excited for it. But before we move on into the nitty-gritty of things, I would love to see where folks are from. So if possible, let's take some time for folks to locate where they are nationwide utilizing this map. Please use the annotate button and place an icon on the state where you are currently located. If you are having trouble locating your annotate button, it should be above the it should be in view options. And if you select annotate and select a stamp, whether it be a check mark, a heart, a star, indicate where you are on the map here. And I see a lot of great states popping up. Fantastic. Fantastic. Hi, Illinois, Indiana. A lot of representation in Florida. Fantastic. Texas, Oklahoma. Hey, Kentucky. Hey, Tennessee. New York, Wisconsin. Hi, Washington State. Alaska. Hello. Hello. Welcome. All right. Fantastic. All right. And we do still have we have territories here as well. So if you are a part of a territory, please feel free to indicate that. All right. Thank you all so much for taking the time to annotate where you are located. It is great to see folks. Um, you can add Michigan to by just utilizing the annotation stamp and just mark where you are on the map here. All right, wonderful. So we're just going to move forward within our session today and take some time to talk about the relevance. So, as we all know, out of school time or OST for school age children has existed for decades. And OST programmings range from home based care services, summer learning opportunities, to before and after care. And these programs provide measurable benefits to youth and families, demonstrating improving in academics, developmental outcomes, along with other results such as positive youth adult relationship building and, of course, social emotional learning. So, as we talk about SCL, and mental health, I want to acknowledge that OST programming can offer social emotional learning opportunities and mental health support. Next slide, Siobhan, please. And so, with these resources, staff and school age children are prepared with skills and tools to thrive and develop personal, professional, social, and academic success. Now, through more evidence, although our evidence is urgently needed, there are strong indications indicating that improving a child's social emotional skills may also help to improve their mental health and well-being and to prevent adverse outcomes. And we can see this relationship here on figure 2 with the research on improving systems and education illustrated here as we see. Now, let's take some time to discuss generally what is SCL. So, I know this is pretty much a review for a lot of folks, but just as a friendly reminder, the Collaborative for Academic, Social, and Emotional Learning, CASEL, are leaders in developing social and emotional learning, the process through in which all young people and adults can acquire the knowledge, skills, and attitudes to develop the following skills: healthy identities, managing emotions, achieving goals, feeling and showing empathy, establishing and maintaining supportive relationships, and responsible and caring decision making. And so, social emotional learning competencies. These are the skills and the habits and the mindsets that fall under the umbrella of social emotional learning. These skills are varied, and OST communities may prioritize different SEL competencies based on the community needs, capacity for support. Now, these competencies are self-awareness, self-management, social awareness, relationship skills, and responsible decision making. Combined, these skills are commonly known as the CASEL 5. Now, research shows that SEL competencies and personal advancement are intertwined. These competencies can work together by teaching students how to share ideas respectfully, have empathy for academically diverse partners, push through challenges to meet goals, and control impulses to make healthy decisions. Now, we're talking about SEL. Let's talk. It's also important to acknowledge mental health. What does that mean? It's a term that we're hearing a lot about, but let's take some time to define. Next slide, please. Thank you. The American Psychological Association characterizes mental health as a state of mind characterized by emotional well being, good behavior adjustment, relative freedom from anxiety and disabling symptoms, and a capacity to establish constructive relationships and cope with ordinary demands and the stresses of life. A large definition, but a comprehensive definition to say. Now, when talking about I'm talking about mental health, it is important to acknowledge the social determinants of health, or SDOH. Now, these are conditions in the environment in which people are born, where we live, where we work, where we play, and all of these things have an effect They affect a wide range of health, including our functioning and our quality of life outcomes. Identifying and addressing social determinants of health is a primary step in achieving health equity. If these factors are ignored or not adequately treated, there can be an ongoing negative and lasting impact on families and their communities. So, in talking about SEL and mental health, we know the importance, but it's really also important to acknowledge how can we infuse these things within the work that we do. And this is where MTSS comes from, also known as the multi-tiered framework. I'm sorry, multi-tiered system of support. Now, social emotional learning equips young people with the mindset, skills, and competencies needed to develop and enhance resilience, emotion, and behavior regulation, relationships with other, and positive coping strategies. And these skills are essential for mental health and well being. Mental health support is often used to help school age young people who show signs of challenges related to emotional and social well being, trauma, stress, depression, or anxiety. Evidence based social emotional learning can help foster emotional intelligence, strengthen conflict resolution skills, and prevent mental health problems. Now, OST should have a OST providers, excuse me, should have a general understanding of the multi-tiered systems of support and be able to connect with providers to ensure health and wellness of a young person. The MTSS model is often described as a triangle or pyramid divided into three tiers, as we can see here on the screen. Each tier offers a specific type of support that is universal, targeted, and individualized. Now, for time's sake, we're not going to do a deep dive into these tiers, but I am going to provide a general overview of what each tier means. Now, tier one, that is the foundation, that is our lower level tier. Now, this refers to support or interventions that benefit all individuals. Depending on the context, individuals may refer to school age young people, children, but essentially they are the communities that we are serving in OST. Now, tier two, refers to supports that target individuals who might be struggling with some social emotional competencies or who have a moderate mental health need. Tier two supports are often organized within small groups, usually and hopefully in safe and supportive spaces, providing security and privacy for all. And then last but not least, we have tier three. Now, tier three refers to supports designated to address significant health needs, including diagnosed mental health disorders or advanced social emotional learning needs and support. This support is often provided individually and or with a licensed mental health provider. So again, this is something that is dealt with someone who has that specialty, who has that experience to support that targeted population. Now, in order to have these best practices and infuse all of these, and infuse SEL and mental health within our work, we also want to make sure that the work is high quality. Now, in talking about high quality programming, this is where we have programs that support the nature and support and nurture our children's overall growth and development, including their social, emotional, intellectual, and physical development. These programs support development by letting young people learn through play, providing positive, nurturing environments, and offering artistic, cultural, and intellectual spaces for social and physical activities, as we see here. So, in moving on and talking about the relevance, why is this important? Well, when children are in high quality programming within the first 5 years, they are given a safe space to learn and to explore the world and build relationships. By being in this type of environment, the foundation is set for them to be successful in school, work, and life. So, the benefits of high quality care have many are come in different capacities, excuse me. High quality child care and OST can help children be more successful, as I mentioned. Now, when we invest in these high quality early OST programs, it can help make sure that we as leaders are providing the best opportunities for young people to grow and learn, but also we want to make sure that we're supporting our staff as well. So when we are incorporating mental health support and SEL supports for our staff who are working in these OST programmings, there is an increased rate for job satisfaction and potential retention. And we know that is incredibly important nowadays. So in moving forward, I want to talk about how program leaders are essential in supporting children and adults' social and emotional learning and mental health. To cultivate well being, adults in schools must feel supported, they must feel valued and cared for. Therefore, it is really important for leaders, program leaders, and system leaders to really take an assessment and scan the staff for feedback. Really take some time to ask, what do staff need? How can we improve their work environment, and how can we make sure that they are feeling appreciated? Additionally, providing equitable access to SEL and mental health resources that consider students' race, ethnicity, language, and developmental level and background is also vital for student success and well-being. And so, and lastly, I want to acknowledge that implementing systemic SEL and mental health support is not a one-time process. This is not a one and done. This is something that must be done ongoing, in practice, this should be monitored and reviewed and evaluated for effectiveness and sustainability. Using implementation and outcome data to continuously improve all program related systems and procedures that focus on policies and focusing on equity. All of these things combined help make high quality SEL and mental health support within OST. And one other way to support high quality OST is by utilizing our out of school time social emotional learning and mental health toolkit, which we see here. Now, this content, the content for our session today is coming from this toolkit and will be available soon. All registered participants will receive notification of when this will be available and accessible to the public. Now, one of the great things about this toolkit is that it provides really great resources for system leaders and for program leaders. So in the next slide, we see that the support for system leaders include making sure that system leaders have a foundational understanding of the ways of life, needs, and aspirations of the populations they serve. And so the following resources provide information, ideas, and examples to assist in understanding and supporting youth SEL and mental health needs at a system level. So this toolkit will provide information on trauma resilient informed best practices, statewide approaches preventing and addressing adverse childhood experiences, also known as ACEs. And it also provides some really great information for being culturally responsive when implementing SEL and mental health supports for youth and for staff. So we always got to remember our staff. Now, in talking about program leaders, we see here that OST programs are responsible for providing care and education experiences for families throughout their service areas. For programs to offer high quality care, staff must have the foundational understanding of the communities that they serve and recognize the importance of trauma on both a provider and a personal level. Now, the following resources our toolkit will provide some really great resources and understanding for program leaders, including, again, how to utilize trauma-informed program practices and implementation strategies for staff development. We also want to make sure that program leaders know about equitable SEL and mental health supports for staff and school-age children. And lastly, it will also provide strategies for high quality family engagement. That's something that is incredibly important. So again, when the toolkit is available, we'll make sure to provide information on how to access it. Now, in talking about best practices, again, All of the things that you see here on this slide are aligned. There must be a mutual commitment from leadership. If there's not a commitment from leadership, the work won't get done. So we want to make sure that leadership is always involved and that there is a solid commitment to implement and enhance these practices. We also want to make sure that we are incorporating youth and family voices, and this can be done by doing a little survey for families, just having general conversations to see what are the things that they need. How can they be incorporated into our OST programming? And we may even hear some really great ideas that possibly could involve having youth and family members actually implement the work within our OST programming. Additionally, we also want to make sure that we are building staff capacity. Now, in talking about staff capacity, this means we're providing professional development opportunities, we're providing resources, whether that be mental health supports or access to get those supports. So we want to make sure, again, we're building staff capacity, because when we build staff capacity, again, this is a great way to let folks know who work within our OST programming that they are valued, that they are appreciated, and hopefully this will increase retention. And then last but not least, we also want to make sure that we are connecting with partners. Partnerships really help make the work thrive. It's really important to remember that, not all of us are SEL and mental health support specialists. We may not have that background, but there are some really great community-based organizations and national organizations that can help build this work within your OST programming. And this toolkit that we mentioned earlier will definitely have information about how to make those partnerships happen, whether it's on a national level or local level as well. So, in talking about all of these great practices, we're now going to transition to our conversation from voices in the field. And so this is where we're going to have some time to talk to our subject matter experts, and some of the questions that, we'll be talking about are here located on this slide here. But essentially, we are just incredibly excited to have OST leaders from the Georgia and Wisconsin State After School Networks joining us today for a panel discussion. We have put links to the resources and materials and they will be talking about today. So we'll make sure that we are sharing them. And we are also allowing our panelists to, add additional resources in the chat as well. So I welcome Uzma, Randy, and Jennifer to our conversation today. So welcome, presenters. We are incredibly happy to have you here. So we are now going to hopefully have our spotlight on our presenters. And presenters, if you can, I would love to open the discussion of what is your why? Why do you do the work that you do? And anyone can start.
Well, I can jump in. So Jennifer Smith with the Wisconsin After School Network. I think my why is the idea that kids and young people really need positive, supportive adults in their life. And we, as adults, we don't just inherently know how to be that person. We have to learn and grow and develop our own skills and understanding. And so however I can help support other adults in learning how to build those skills and be positive adults for kids is my why.
Thank you so much.
I'll follow Jen. Randy Neeb with the Wisconsin After School Network. I would say my why, and I'll bring it to kind of this discussion here on out of school time, is I firsthand seen and experienced the effects of high quality after school programming for kids, especially kids that are in need of additional and more services. So we've had things going on in our community. Jen can attest to where we've had some high quality programs and we've saw firsthand the impacts they've had on kids.
Thank you, Randy.
I'll close it out. Hi, everyone. My name is Usman. I'm with the Georgia Statewide After School Network. And Honestly, out of school time is just such a crucial part of providing a child with all the supports that they need to really thrive. It is a great opportunity to just let them explore themselves in a safe environment while exploring relationships and building those skills to be able to thrive in life. That it's just, I feel like every kid needs to have access to that.
Absolutely, absolutely. Thank you all so much for being here today. So, as I mentioned, we're going to take some time to talk to you all as experts, as leaders, as champions in this work. And so, I would love to hear from you all and just having a better understanding of, what processes did your organization go through to develop any resources, trainings, opportunities that work to enhance SEL and mental health supports within your respective organizations. Um, Randy or Jennifer, would you like to go first?
Yeah, absolutely. So I really appreciate some of the opening slides and the commentary on the idea that this is really ongoing development and improving our programming and helping to educate the adults and staff who are in our spaces. So as a network, we've really kind of been on a journey to start and continue to develop these supports and resources for staff. And it really started a number of years ago with one of our foundational courses called Guiding Children's Behavior, which is really kind of one of those tier 1 interventions. When you had that pyramid that talked about it's the universal approach, and it really starts reframing the idea that challenging behavior is really a need for skill development on the part of young people. And rather than using punishment and coercion, which is not going to help kiddos develop those skills, we really need to focus on where are there some skills lacking and what can we do in our program space to help practice some of those skills to help kids better navigate those challenging situations. So I think that's really, kind of where our journey began. And then we've continued to evolve. We wrote a course on trauma-informed care and out-of-school time programming, which is really universal in creating that really safe and supportive environment, but then is a little bit tier 2, really looking at kids who might need some additional interventions. And that really was initiated through some feedback from the field that they were looking for some supports in that area. And then our most recent projects, which is really what we're highlighting today, really expanded into other modalities, moving beyond kind of the traditional course and really looking at mental and emotional wellness as a learning series and social determinants of health. So I love that you brought that up at the beginning in the slides. And we really heard that like short on-demand accessible videos and podcasts are what the field is looking for, things that we can implement right away. And so we worked with some mental health providers and other partners in the field to develop some topics. And then we created a webinar with a bunch of supporting short videos, and we'll be launching some podcasts that are really elevating programs and practitioners in the field who are doing some of these things in their program spaces to really elevate and highlight what you can be doing in your program space and make it really attainable. And so that's kind of been our big project recently.
Wonderful, Wisconsin. That sounds fantastic. Usman, would you like to share some of the great things that you and your organization are doing to address social emotional learning and mental health support within your organization?
Absolutely. So similar to Wisconsin, a lot of our work is informed by the field in what they have expressed their needs are. Back in the spring of 2019, we did 5 roundtable discussions across the state. We gathered about almost 40 different providers and just heard from them around what kind of challenges are they facing in their program, what kind of resources would they need, what kind of successful strategies have they employed, and like just what would they need from us so that they can better support the behavioral health needs of kids in their program. And by no means are we trying to make OST professionals into mental health providers, but just giving them all the tools that they need to be able to really like set their kids up for success. And a lot of what we heard was similar: lack of training opportunities, lack of resources. And one of the biggest things that we heard was that a lot of the time families and kids come to our programs and we just don't know what to do. We face certain behaviors and we don't know if it's like a matter of we need to be providing certain engagement or we need to actually refer them to a professional. And if we do have to refer them to a professional, what are those resources? Where do I go to look for them? So that has been like the impetus of what started this. We also consulted with a mental health provider with 20 years of experience, made sure to incorporate all the things that we heard from providers, not only in those discussions, but over the next few years about like, what are these different areas of work that they are seeing in the program. So that's why we made sure to include not just like, what does ADHD look like, but like, what does different forms of aggression look like what is like an actual mental disorder versus like what is just a behavior. And yeah, that's we've been providing trainings as well. We've also made sure to incorporate mental health and social emotional learning focuses in our biannual conference that is attended by about usually 600 to 800 providers from across the state. So it is a much needed resource that we are happy to provide.
That is fantastic. And, both you and Jennifer briefly talked about, who you had at the table to have these conversations. Who else did you have? Were there internal folks that you had at the table to help create these resources, or were the stakeholders, partners exclusively external? I would love to hear from you, Usman, and then we can go to Wisconsin next.
So yeah, a little bit of both. As I mentioned, we did contract with someone who had extensive experience, but we also wanted to make sure our executive director at the time was also a clinically trained therapist. So we made sure that like we had multiple eyes on it. And then on the other hand, someone like myself doesn't have that mental health background. So being able to see it and be like, okay, this makes sense to me. So like any OST professional will be able to pick it up and like make sense of this. So just putting it in front of like different eyes, making sure that like it was something that would be useful.
Absolutely.
And helpful.
One of the things that you said that stuck out was that, you had your leadership a part of this conversation. And again, that is just so important to have that commitment from leadership. So thank you for sharing. Wisconsin, you also briefly mentioned some of the great partners that you had at the table. Can you share with us a little bit more about who those folks were and if you had some internal folks as well to help with the support of creating your resource?
I think Randy wanted to start this one off, and then I'll kind of jump in.
Can kick this one off, and it ties into Jen's previous discussion on all the different resources that we develop. A policy piece that the network has been working on, and that's another area besides quality that we do policy work. And I know there's a lot of childcare agency or childcare state agency folks on this call, is the courses that Jen referenced, the Guiding Children's Behavior, our school age curricular framework, and our introduction of school age, which are heavily youth development foundational courses. We work closely with our child care agency for them to be recognized by the state and count for licensing. So for all of our school age programs that are either licensed, or even if they're license exempt and they're accepting child care subsidy, like our large school districts, they take those courses and it gets them licensing, but it also gives them a really good foundation in youth development and behavior guidance and behavior management. So some of those foundational things. So we developed those, and then we also twisted them into being recognized by our licensing and also recognized through our quality rating system.
Oh, that's fantastic, Randy. Thank you for sharing.
So yeah, and then I'll turn it over to Jen, the other piece.
Yeah, absolutely. So I did mention a few people in my initial response, but one of the benefits that we have as a network is our fiscal agent is a health system. And so we have access to mental health providers within the system who can collaborate on some of this work with us. And so we're pretty fortunate that we had 2 PhD level psychologists, one who is an adult psychologist who really focused on how do we support the staff in this learning and this process, and then a youth and adolescent psychologist who really focused on the tools that we can implement in program spaces. So having access to those experts was really foundational. And then within the network team, we have a couple master's level staff who were involved in this process, as well as external folks. So we did bring in a number of OST program leaders in the state to kind of help inform some of this, and then help us make connections to those programs in the field who are doing this work and are doing it really well, and could lift up what is happening on the field, in the field, and what it looks like kind of on the ground in real time. We also have a program that I didn't mention in the opening that is called Life Tools, that was developed by our child and adolescent psychologist. That's an 8-week learning series that's really targeted for a small group of participants to be delivered during the after school hours, but it's really in partnership with another organization in your community. So either the school day, maybe the school counselor comes in and facilitates that group during after school time, or a community-based mental health provider can come in and deliver that programming during out of school time. It's an hour a week for 8 weeks, and it's supported by the psychologist who does monthly check-in calls with the individuals who are facilitating that group after school. And Randy could probably tell you the number of districts. It started out as a pilot in one after school program, and now I think it's in like 30 something after school programs around the state. I don't know the exact number offhand, but another really powerful intervention that we've kind of developed over time.
That is phenomenal.
It fits into that year pyramid. It's a tier 2 intervention that we're doing with 40 different out of school time programs that are utilizing 40 of their school counselors to then implement it. So it's been a nice another nice kind of service for folks and kids.
That is fantastic. And one of the things that that I want to share is that when folks were able to register for this session, they were able to identify, what are some of the pressing topics that they would like to hear about. And so workforce supports was actually one of the leading topics. So I'm glad to hear that our champions here speaking were able to address how they were able to support their workforce. So that is really good to hear and to know. I guess another question that I would like to turn to is sustainability and funding. These are things that are pressing and a legit concern for a lot of folks. So I am interested to hear, what was the funding source for your resource training opportunity that you were able to create and to provide for your community?
You want Wisconsin to take that first?
Sure. Go ahead,
right.
Wisconsin, Midwest love.
Well, we've been fortunate to have a diversified funding portfolio for this mental health work. Really started at the base level, where, as Jen alluded to, we're both Marshall Clinic Health System employees. It's a program. The network is a program of the system. So the system did put in some, as I like to say, some venture capital, which gave us some foundational resources to do some of this work and get it kind of off the ground. Another critical funding stream has been the Mott Foundation as a state network.
Can you talk a little bit about what, yes.
The Mott Foundation. So
yes, please.
The network is a part of the 50 state after school network. Juan has been there since 2008, has been funded by the Mott Network. It provides foundational funding, focusing on quality. and advocacy and policy work. So we did receive some funding, some additional funding from them back in about 2014, basically when Jen came aboard to the network in the health system. And we really wanted to focus on trauma, kind of when it was first coming out. Our governor at that time, Scott Walker, was really big. That was a pet project of him and his wife around trauma. So we developed with some funding from the Mott Foundation. Jennifer and some key people developed a 15-hour course, Jen, trauma-informed care in the after-school programming, which really kind of took off and was some of our foundational work. We did some policy work on the other end with the legislature and getting funding into programs so that they could better address trauma. So the Mott Foundation and the health system were big foundational pieces with that. Then through time, through our governor's office, Department of Administration, we received funding from them to do some very specific projects, as Jen alluded to, videos, podcasts, webinars, that type of stuff, expanded our reach and our partnerships to now we have contracts with our Department of Public Instruction, which is our state education agency. We work with our 21 CLC after school programs. That funding has helped some of the mental health work. And recently with our Department of Children and Families using CCDF dollars, we've been doing has been able to expand our footprint in mental health, social determinants of health work. So we've added a diversified funding stream that has, been foundational, but then allowed us to expand, extend, and create new things and be innovative with these changing times. The most recent funding is because we are contracted for the school age rating system in Wisconsin, known as Youngstar. We do all the school age work. That funding also allows us to expand our footprint, working with all the programs. I think there's 520 programs throughout the state that are in the school age that are in the rating system. So that funding also has helped. So diversified funding stream that's that's really expanded our work. So
That's phenomenal. Thank you. I mean, I think that's also really important to recognize that, it's important that if you have the capacity to do so, try to get as many funding streams as possible, because we want to make sure that we are trying to be sustainable with all of this great work. Georgia, tell us how are we doing this? How are we doing all this great work? How are we
I
funding?
feel like Randy just named like literally all the funding
No.
streams. But I mean, yes, we are also thankful to the Mott Foundation for providing that foundational funding to like all 50 statewide after school networks. In addition to that, we also have an annual contract with our Department of Behavioral Health and Developmental Disabilities. And that has been crucial in funding all of our quality improvement work. As I mentioned, our biannual conference is based on the Georgia After School and Youth Development Standards, which we lead in conjunction with another organization. And DBHD does fund a lot of our work there, as well as other virtual training opportunities that we provide on an ongoing basis. I think the other thing that has been helpful is that providers who attend that conference are also eligible for hours through our licensing agency, so that it's similar to Wisconsin. We are able to like leverage that so that providers are getting up-to-date school age relevant SEL and mental health information and being able to use that towards their required hours. The toolkit itself was also created by the support of our Department of Behavioral Health and Developmental Disabilities. Sorry for the very long name. And I think what has been helpful for us is that, I don't know if y'all have heard, but like the past year or so has been called the Year of Mental Health in Georgia, where like our legislature and our governor have also taken mental health very seriously. We passed the Mental Health Parity Act, which has been really helpful in terms of like implementing and like just making it easier to like bill for mental health services in different settings. And in fact, our governor last year also gave about $120 million for the creation of school-based health centers.
Oh, wow.
throughout Georgia, and like school-based health centers, like the more comprehensive ones tend to have mental health supports built in as well. So I think it's been really helpful that like this conversation has been elevated at all levels in the legislature and in the state house. So it seems timely.
Absolutely, absolutely. And I'm so glad to hear that there is a collaboration with school-based health centers because they are also a phenomenal resource that, address social determinants of health. They are easily accessible and many of them are comprehensive. So young people and sometimes the communities, all the communities that they serve, are able to access quality care. So that is phenomenal to hear. And I guess, my last question, and then I'll open it up to our participants here, our members here who are joining us in this webinar. What is the impact and the outreach to date? I heard that, Wisconsin, you're doing a lot of great work in what I think you said 40 schools, and Georgia is doing fantastic work, not only at the local level, but at the, statewide level. But I am interested to hear from our panelists. What has the impact been from the great resources that have been created to date?
Well, I mean, in Wisconsin, just looking at some of our uptick in demand for the courses and demand for our webinar series and all, we know that Wisconsin's got 72 counties. We know that at least 68 of our counties have some way, form, or fashion been impacted through our professional development system. As we look at that, can we say that all those folks were specifically hitting all of our mental health sports? We don't know that quite. We do know that in this last year, we hit 2,000 unique individuals that have attended some of our training and technical assistance, conference courses, webinars, SDOH, et cetera, et cetera. We've seen that at least our reach significantly grow over the last couple of years. I think it's because of we're providing topics that are timely, mental health. I think the team that Jen has put together are producing very high quality, relevant to OST folks. And I highlight that relevant and very implementationable for them. So yeah, our reach has significantly grown. Also, I think just because we've created trainings and courses that in essence are required. And so people have to have them. And so that's been a little self-serving, but we also feel they're of high quality. So we've really expanded our reach, and that's been for a number of reasons.
Fantastic.
And if I can add just one really quick thing, we did create a YouTube channel for the network just in the last 6 months. And our mental and emotional wellness learning series playlist has like over 400 views currently. So I think people are really utilizing those kind of on-demand available resources, which is what we heard from the field they wanted. So I think that helps us to know we're kind of tracking in the right direction.
And Bianca, one of the things Jen, speaking the praise of Jen and her team, they make things very concrete. These are, and there's some theory around all this stuff, but very concrete and actionable, that if I'm a 20-year-old college kid and I'm working at a YMCA program, summer day, whatever, these are some very actionable and easy things and tips that you can do that can support a child's well-being. So stayed away from a lot of the theory and what you can do in your environment, in your space.
That is phenomenal. Well, I want to thank our panelists here today for this remarkable conversation. It has been great learning about all of the fantastic work that you are doing. And I look forward to accessing and sharing those resources, not only with our members here who are joining us, but I also want to take a look at them too to see what else can we do, and in case to support this work. So I thank you so much for your time today. I now want to make sure that we take some time to hear from the fantastic folks who are joining us today. So we have created a Padlet that will be accessible into the chat. And I really just briefly, we'll take maybe 3 minutes for folks to identify, what are some of the successes that you have seen within your work, within your organization. Would love to hear from system leaders, from program leaders, and then we also want to take some time to hear about some of the partnerships and resources that you were able to utilize. So I believe the Padlet link is here within the chat. And we will take some time there it is, thank you so much. We will take some time to just briefly just have a brief discussion about, what folks are doing. So if you have the capacity to do so, please access the Padlet and indicate under the plus sign, what partnerships have you utilized? What resources have you utilized? And, just what are some successes that you have had in supporting SEL and mental health in out of school time? And if you don't feel comfortable utilizing the Padlet, that's totally fine. Feel free to use our chat. Sometimes that's easier for folks, and we can incorporate that into the Padlet. So I'm just going to give folks about 2-3 more minutes to upload their great information. Wonderful. I see we have some content in here already. All right, partnerships. That's phenomenal. Phenomenal. Wonderful.
I see people are adding resource links too, or links under partnerships, which is always great because then we can share with the participants after this event.
And I am resharing the link one more time to the large group here.
Yeah, we have a few more minutes, Bianca, like 4 minutes or something. So if people are still typing and composing, they have a bit more time, I think.
Wonderful, thank you. Shaban, either the text is getting smaller or my eyes are getting weaker. Can you share so far what we have listed here within this Padlet? Because I see some
Sure.
great information that's being
Absolutely.
shared.
Under system leaders, successes, connection and collaboration with school day staff, expanded learning staff, and mental health providers. Oh, that's excellent. That connection across systems is so important. For program leaders, restorative circles focused on SEL and mindfulness. And I see groundworkcenter.org, but I can't actually read it. I'm sorry. Under program leaders as a resource. Under partnerships, play therapists, behavior therapists, and IFMH. And I don't know what that is. Michigan uses the Forum for Youth Investment Weichert Center for Training. Great, another collaboration. Oh, thank you, infant mental health therapists. Thank you. Working with the school board association to co-create materials for educators, university students, having interns from undergraduate and graduate programs that come and offer SEL groups weekly.
That's a big one. That is a big one.
And then I see another, wait a minute, let me make my screen bigger. Oh, okay. I see another link, contentment.org, transform the well-being of your entire school, as another resource. And then I see a couple more resources in the resource column, Ruler, SEL training for staff. Oh, okay, and Eloise has shared something in the chat, CFC Inc. After School in Fall River, Mass. All right, I lost you. Has worked with the Justice Resource Institute, who is providing coaching. And NAMI has provided, wait, sorry, I lost that message. In-person training, mood lighting and soothing music, and sound machines that have been incorporated into the environment for children. This is so great. Thank you, everybody, for sharing this. As I said, we will include the information shared in the chat and the resources also shared on the Padlet after this event. And now I think we'll stop sharing the Padlet and we'll do our wrap up.
Absolutely. Thank you all so much for sharing. And, you know, one of the great things about sharing these resources is that no matter if you are a seasoned professional or someone who is fairly new to the work, learning about new resources and seeing what else is out there is always helpful, no matter what stage you are within the field. And so I want to wrap it up with the question of, you know, what is your why? And I think everyone who was able to share, you know, why do you do the work that we do? And I see that based off of this phenomenal word cloud that we have here, a lot of folks said, you know, they want to support children, support families, and provide access and giving back and, you know, support, you know, and these are all things that are incredibly important. And these are the things that we have to remember as well. You know, the work of being a systems leader, a program leader, you know, within the out of school time, it can be challenging at times. And so it's always just incredibly important to remember, what is our why? Why do we do the work that we do? Why do we wake up in the morning and log into our computers, or, you know, take that 5, 10, 15-minute drive or transportation to work? And then again, it's all because we want to make sure that we are supporting our future kiddos, so that they are successful not only within their personal life, but also their academic life and professional life. And again, great ways that we can support our young people is making sure that we are utilizing high quality programming and high quality SEL and mental health support within our work, because the kids are the reason why we do this work. And we just want to make sure that we are providing them with the best opportunities possible. For more information about the content that has been shared, we have a resources page here that acknowledges where we got all of this great information from. And it highlights our leaders, our panelists, excuse me, the content that they talked about today. And so we have the Georgia Behavioral Health Toolkit that is here. And we also have some great links and Wisconsin courses that are approved within our in-case toolkit. And just again, wrapping up, our resource library is here. It is available for everyone to use. Siobhan, would you like to talk a little bit more about this fantastic resource library that we have?
Sure. We have over 400 resources from a number of organizations, and actually on the resources page that was shown previously, we have a link to a direct search for mental health resources. So we hope you'll check it out. It's for all different levels of work in OST, and it covers a number of topics, and we update it quarterly. And now we'd really appreciate if, when we close out today, you could take a few minutes to give us some feedback. We really use your feedback to shape future webinars, and we take it very seriously for our continuous quality improvement. So we appreciate that. And when the meeting closes out, the survey will automatically launch. So thank you so much for joining us today. As we said, the recording and materials will be sent out after the event, and we will let you know when the toolkit has been published. Thank you so much.
Thank you all for your time.
Goodbye.